This is the Pick Your Poison podcast. I'm your host, Dr. JP, and I'm here to share my passion for poisons in this interactive show. Will our patients survive this podcast? It's up to you and the choices you make. Our episode today is called Sweet and Sugary. Want to know what toxin affects humans but not bees? What contaminated substance is so valuable people risk their lives to collect it? What popular natural substance was used in biological warfare in wars between Russia and Ukraine in the past? Listen to find out. First, I want to say Happy New Year, welcome to Season 4, and thanks so much for listening and making all of this possible. Today's episode starts at a music festival. Your friends have rented a house nearby, and you took them up on their offer to stay for the night. After a day of great music, you crawl into bed in the early morning hours. Shortly thereafter, a banging sounds on your door. You pull the pillow over your head and try to ignore it. It increases in intensity. It's your friend yelling, "Wake up! Wake up!" Her partner is sick. As you pull on a sweatshirt over your pajamas, you ask her through the door, "What's the matter?" She says he feels dizzy and lightheaded. You're tempted to shout back, tell him to go drink some water and go to bed. After all, it was a music festival with unhealthy food, copious amounts of alcohol in which he indulged to excess, and all sorts of other mind-altering substances. Instead, you open the door to see what's happening. Her partner's laying on the bed with his eyes closed. He looks sweaty. He responds to the sound of your voice, but says he's keeping his eyes closed because he's so dizzy. 2 hours ago, just before you all left the festival, he developed nausea, vomiting, and diarrhea. He feels numb and tingly all over. A few minutes ago, he stood up to go to the bathroom and almost passed out, prompting your friend to wake you up. He denies significant abdominal pain or fever. Your friend is not sick, nor are you or anyone else in the house. You ask him how much he drank this evening. He says too much to remember. Asking about substances, he says marijuana edibles, but denies other drugs. He also denies medical problems, medicines, or over-the-counter medicines and supplements. He doesn't look great, but he's otherwise healthy and none of these symptoms are particularly concerning. You have some anti-nausea medicine in your suitcase. He agrees to a dose of ondansetron or Zofran. You tell him to give it 20 or 30 minutes to work and then take small sips of water. You say you'll check in on him again in the morning, which is now just a few hours away, but to wake you up in the meantime if he feels worse. You go back to your room, sink into your bed, doubting you'll hear much else. Just as you're about to fall asleep, you hear a thud from the bathroom. You jump up and find the partner collapsed on the bathroom floor, covered in vomit. He ran in thanks to extreme urgency from diarrhea. He became dizzy and passed out. Before he could get himself up off the floor, he vomited everywhere. Fortunately, he fell on a fluffy bath mat and denies headache or other traumatic injury from passing out, but reports ongoing dizziness, vomiting, and diarrhea. All right, well, conservative management at home does not seem to be working, so you recommend he go to the emergency department for some IV fluids and some IV nausea medicine. This is a fictional case, so of course, you're the doctor. In the emergency department, his chart notes he's 41 years old. His temperature is normal at 98.6 Fahrenheit or 37 Celsius. Interestingly, his heart rate is low at 42 beats per minute. So is his blood pressure at 100/60. His respiratory rate is normal at 18 with the pulse ox 100% on room air. You take a little more history. He denies cough or flu symptoms. He's not having any urinary complaints, and he doesn't have any significant abdominal pain, just some cramping with the vomiting and the diarrhea. His appearance is the same as before. He looks pale and sweaty. Other than the low heart rate and borderline blood pressure, his exam is unremarkable. He's got a normal neurological exam and muscle tone, normal lungs, and no abdominal tenderness. You order several liters of IV fluid, some IV nausea medicine, and basic labs. What do we make of these vital signs? Well, it's difficult to know at this exact moment. One of the most common causes of passing out, syncope in medical terms, is called vasovagal syncope, and you've probably heard of it, you may have it. It's when someone passes out due to a sudden drop in blood pressure. For example, it's common in young women with low blood pressure at baseline, and if they stand up quickly or stand for a prolonged period of time, then the blood pools in their feet and doesn't get to their brain. To fix this problem, the body puts the brain on level with the feet by passing out very briefly and restoring circulation. The vasovagal part of the name refers to the vagus nerve. The heart, like other organs, has both sympathetic, fight or flight, and parasympathetic innervation, which is rest and digest. The vagus nerve is parasympathetic, and it's responsible for slowing your heart rate. If you have too much vagal tone from this nerve, your heart rate stays low, for example, when you stand up, rather than increasing to increase cardiac output and blood flow to your brain. What causes increased vagal tone? Tons of stuff, most of which are perfectly normal physiological responses. Think again, rest and digest, eating, deep breathing, those increase vagal tone, yoga, meditation, extreme temperatures like a cold shower or a hot sauna. Athletes naturally have increased tone. This is why runners have low heart rates. These are all normal physiological responses, and vasovagal syncope occurs when the body essentially overcorrects. Why am I talking about this? Because vomiting is a big thing causing increased vagal tone, which is why when you throw up, sometimes you feel like you're going to pass out and you might get extremely sweaty. He says, "I'm going to throw up." You grab a basin and the nurse goes to get the nausea medicine. In an elderly patient, I'd be more worried about the low heart rate, but he's otherwise healthy, so the most likely cause here is a vagal response to vomiting. Some of you might be worried this low heart rate is causing the low blood pressure, and certainly that's possible, but it's just as likely that this low pressure is from dehydration thanks to the copious amount of alcohol he ingested at the festival, along with the vomiting and diarrhea. I'd definitely take notice of these vital signs, but at this point I wouldn't get too excited about them. I'd expect him to improve with anti-nausea medicine and IV fluid. I think it's worth checking an EKG to make sure we don't see anything unexpected. A few minutes later, the tech hands one to you showing sinus bradycardia, which means a slow but normal heart rate without evidence of heart block or conduction problems. You tell the nurse to let you know if anything changes and move on to the many other patients waiting to be seen. An hour later, the nurse updates you saying nothing has changed. All right, well, it's good he hasn't gotten worse, but it's a little odd he hasn't improved. His heart rate is still in the 40s, and his blood pressure is about the same. He continues to have vomiting and diarrhea, now to the point of fecal incontinence. You're in the middle of about 100 more emergent issues, so you order more nausea medicine, more IV fluids, thinking maybe he just needs more time. You go back to the room to check on him later, about now 2 hours after arrival. He's wobbling in the middle of the room, and you and your friend grab him just in time to keep him from falling. Against the nurse's advice, he got out of bed to use the bathroom and became very dizzy. All right, well, it seems like there's more going on here than a simple case of nausea and vomiting from too much alcohol, food poisoning, or gastroenteritis, i.e. a stomach virus. Certainly, cases of gastroenteritis and food poisoning aren't cured in the emergency department, but most patients feel much better after a few hours and are well enough to go home with some nausea medicine for oral rehydration. The differential diagnosis for nausea and vomiting is basically unlimited, as we've discussed before. I think the unusual symptom here is the low heart rate. Most people with vomiting and diarrhea have high heart rates due to dehydration, and as I said, most of those are fixed with a bag or two of IV fluid. So why is his heart rate persistently so low? It's not uncommon to see transiently low heart rates from increased vagal tone. Generally, it lasts for a few minutes. Occasionally, it lasts longer, but I think this is really too long to attribute the low heart rate to increased vagal tone at this point. So let's talk for a few minutes about bradycardia. As I alluded to earlier, there are several different kinds of slow heart rates. You can have conduction problems where the nerve impulses aren't conducted through the heart. This can result in different types of heart block. Sometimes these patients may need a pacemaker. Does our patient need a pacemaker? That's question number 1. A, yes. B, no. The answer is B. No, he doesn't need a pacemaker. Yes, he does have a low heart rate, but in his case, the EKG, if you remember, showed a normal, just slow heartbeat. And that's not normally an indication for a pacemaker. Usually those are for conduction problems. Is this bradycardia dangerous? Well, it's a good question, and I think the answer is yes and no. He does have signs of hypoperfusion, meaning his circulation isn't great, and it probably is the cause of his low blood pressure now that we've treated and eliminated dehydration with several bags of fluid. More importantly, the dizziness and passing out with standing means his heart is beating too slowly to support his circulation. That said, his circulation is fine when he's laying down. He's awake with good pulses and an adequate, if low, blood pressure. Is there something else we can do to treat this? Atropine, did I hear someone say? Atropine, if you remember, is a cholinergic drug, meaning it works the opposite of the vagus nerve, and it increases the heart rate. You and your friend maneuver her partner back into bed without him falling. You ask the nurse to bring a bedside commode so he won't try to walk to the bathroom, and you order more nausea medicine. You ask him again about the music festival and his exposure to substances. He repeats again he had a lot of drinks, a lot of marijuana, but doesn't use substances and didn't do so at the festival, at least as far as he remembers. He does admit that some of the parts are fuzzy. Could this be a drug of abuse? Well, there's plenty of those at music festivals. We talked on a prior episode, Adulteration, about a fentanyl adulterant that causes a low heart rate. Could this be medetomidine? It is a really great thought, but he denies opioid use, and you were around him much of the time yesterday, and at no point did he show any signs of fentanyl use. Seems kind of unlikely. Sympathomimetics like cocaine and meth can have significant cardiac effects. It's generally ischemia, like a heart attack, and they usually cause rapid heart rates, not slow ones, so doesn't quite fit. I have to say there really aren't that many drugs of abuse causing significantly sustained low heart rates. What does cause a low heart rate? Hypothyroidism or low thyroid, heart attacks, Lyme disease are on the list, but none of these really fit. Now, we've talked many times about calcium channel and beta blockers. Those are blood pressure drugs that also lower your heart rate. Could he have taken something like this? It's possible it fits with his vital signs, but how would he be exposed? Was there a contaminant in the marijuana? I mean, this isn't really the most likely scenario, I have to say. Clonidine, we discussed before, and its analog tetrahydrozoline found in Visine. Did somebody spike his drink with Visine? Well, anything is possible, especially in toxicology. But if you have significant bradycardia, I'd expect more of an altered mental status, at least some lethargy, which he doesn't have. Electrolyte disturbances like low potassium can cause it, though in that case I'd expect to see more changes on his EKG, but his labs are pending, so we'll find out. Exposure to organophosphates like pesticides, sarin, or VX gas cause a low heart rate. Certainly, they cause a lot of vomiting and diarrhea. But I'd also expect muscle weakness and, quite frankly, more serious life-threatening symptoms. If you remember, bradycardia is one of the killer bees. He's certainly not well, but he's not exactly critically ill or dying at this moment either. What about the stuff, your friend says, gesturing vaguely in the direction of his groin? The stuff, you ask? The, stuff for, she says. The patient doesn't answer. You have no idea what she's talking about. Her cheeks are turning red. The whiskey shots with the honey, she says. This sounds like a cocktail, not a medical problem. Question number 2. What toxin is often associated with honey? A. Tetrodotoxin, B. botulism, C. arsenic, or D. cyanide? The answer is B. Botulism toxin is often associated with honey. Is this botulism toxicity? No, definitely not. He would have flaccid paralysis, which is not an issue here. In fact, honey has been contaminated with a number of things. It's a natural product, obviously, and while pollinating, bees can incorporate toxins from other nearby plants. Datura, i.e. Jimson weed, has been reported causing anticholinergic symptoms and an altered mental status. Belladonna, even morphine if poppy flowers are nearby. Generally, these are rare occurrences, not causing significant toxicity in humans even after exposure. But there is a toxin whose presence in honey is actually cultivated, sought after, and very expensive. Mad honey, you ask? No way it's that, he says. My friends mixed it in with the whiskey and we all drank a bunch of shots. They told me it's an aphrodisiac. It's time to pick your poison. That's question number 3. A. True, this is mad honey poisoning. B. False. The answer is A. True. These symptoms definitely fit with mad honey. All right, so first, what exactly is mad honey? It's honey contaminated with rhododendron plants. And I don't know if you know, but rhododendrons are poisonous. They contain a toxin called gryanatoxin. And if rhododendrons grow nearby to the beehives, the bees may produce mad honey rather than regular honey. What happens if you're exposed? Well, typically the symptoms start within 30 minutes or so and last for about 6 hours. Gryanatoxin is a sodium channel poison. It binds to sodium channels, which we have in all of our cells, holding the channels open. This means the cell can't conduct impulses normally, and this accounts for the numbness and tingling that a lot of people report. In the GI tract, it causes nausea, vomiting, and diarrhea, with diarrhea so severe it can cause incontinence. In the heart, gryanatoxin basically overstimulates the vagus nerve, leading to too much vagal tone, leading to bradycardia. Sometimes it can cause more severe conduction disturbances, including complete heart block. Despite this, though, patients rarely require pacemakers because the symptoms usually resolve after a few hours. In fact, in a paper looking at nearly 1,200 patients who were exposed to mad honey, no deaths were reported. Do people ingest mad honey by accident? Well, this is toxicology, so anything is possible. But no, most of the time it's not ingested by accident, but by intention. Mad honey is, I don't know if cultivated is the right word exactly, but beekeepers intentionally produce it in many areas like Turkey. It looks different than regular honey. It has a dark red color, and it also has a bitter taste. It's worth so much money that people literally risk their lives to collect it. The 2 big regions it comes from are Turkey, as I said, and the other is Nepal, in the Himalayas. If you want to see some crazy videos, look this up. These men aren't just battling bees, but the actual environment. They're on homemade rope ladders, dangling from the sides of not just a mountain, but from the Himalayas, collecting mad honey from huge hives on the side of cliffs. In the West, mad honey can cost as much as $150 per pound, and in Asia, people reportedly pay thousands of dollars per kilo for rare forms of mad honey. So why eat it? Why would you pay so much for it? Well, that's a great question. Mad honey and its properties have been known since ancient times, and in fact, it's believed to be an early biological warfare agent. More on this in a couple minutes. Historically, it's been used to treat gastrointestinal problems like indigestion and gastritis. It's treated arthritis, flu, diabetes, and it is still used by some people for these reasons today. But the biggest reason it costs so much? Its use as an aphrodisiac, and it's especially popular in Asia. It's therefore not surprising 75% of mad honey complications are reported in men, often middle-aged men. Mad honey is also reported to be a hallucinogen, thus the name, particularly in ancient times. So much so that some wondered if it's the source of visions at Delphi, the Greek oracle. Hallucinations, though, are not part of the reports in modern medical literature, so it's unclear if this is an issue of accuracy in historical sources or if the composition of the mad honey has changed over time. Guaianotoxin concentration itself is cyclical. Mad honey is often more potent if collected in the spring because, as I said, it's a natural product reflecting plants nearby the hive, so the composition can easily change. Now, what about the bees? That's question number 4. What effect does guaianotoxin have on the bees? A, it affects flight. B, it affects reproduction. C, it has no effect. The answer is C. Interestingly enough, guaianotoxin has absolutely no effect at all on the bees. All right, back to our patient. What is the treatment after exposure to mad honey? Did we do the right thing? Is there an antidote? Well, the treatment is generally supportive care. The symptoms generally last 6 hours, as I said, maybe a day at most. Atropine can be helpful for the slow heart rate. Guaianotoxin doesn't directly cause anticholinergic toxicity, but it does result, as I said, in excessive anticholinergic symptoms, specifically in the GI tract and the vagus nerve. Permanent pacemakers are not required, as we said, given the short duration of the symptoms, but some patients do require a temporary pacemaker. What's the difference? Well, a pacemaker, as I'm sure you know, is a device implanted during surgery that stays in. A temporary one is a wire floated into the patient's heart via a large catheter, and it's attached to a machine outside the body. Once the patient recovers, you pull the wire out, and that's it. Nothing permanent is left behind. The nurse tells you our patient's heart rate is now in the 60s after some atropine, and his blood pressure is improving to 110/65. All right, so let's talk about the really fascinating part of this, how it's been used in warfare as a biological weapon. Mad honey exposure is documented as far back as 401 BCE. The historian Xenophon described its effects on Greek soldiers in Turkey after they came upon hundreds or thousands of beehives. They ate the honey, they became disoriented with vomiting and diarrhea. Essentially, it knocked out the soldiers for about a day or so, and then they recovered. Mithridates in 65 BCE used it intentionally to poison the Romans. He staged a strategic withdrawal, placing combs of mad honey in the path of the oncoming army. The soldiers ate the honey and became confused and were easily killed. Reportedly, 500 to 2,000 victims died this way. Warfare between the Ukrainians and the Russians, I'm sure you know, didn't start in modern times. In 946, Queen Olga of Kiev sent several tons of fermented honey to the Russians in mead and then massacred 5,000 confused soldiers afterwards. I don't know if the Russians remembered this in 1489 when they put mad honey in mead and then quote-unquote abandoned their camp. This time, reportedly 10,000 Tartars were slaughtered by the Russians after drinking the mead. All right, back to our patient. His heart rate improves and the vomiting and diarrhea gradually subsides. He's discharged from the emergency department without sequelae after 6 hours. This is a fictional case, as are all our cases to protect the innocent, but it is based on real poisonings. The last question in today's podcast in our pop culture consult. What movie adaptation of an Agatha Christie book featured mad honey? Was it A, A Haunting in Venice, B, Death on the Nile, C, Murder on the Orient Express? Follow the Twitter and Instagram feeds, both at PickPoison1 for the answer. Remember, never try anything on this podcast at home or anywhere else. Thanks for listening. It helps if you subscribe, leave reviews, and or tell your friends. Transcripts are available at pickpoison.com. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Until next time, take care and stay safe.